I also just have a drive, absolute drive, and I just feel very, very happy. And I also have a wonderful sex drive. And I'm 75.
Apheresis is a Greek word which means to take away. Today, apheresis is used to describe automated medical procedure which separates whole blood into its components. It is widely used in blood banking and in therapeutic apheresis. Two technologies that are involved in therapeutic apheresis, one is a membrane technology, the other one is centrifugation. Membrane technology separates plasma from the cellular blood components, and it's limited just to plasma exchange. It can remove plasma, but no other cells. The centrifugation technology is more flexible, and it's used predominantly in the United States. It's much more popular here than in other countries. Next slide. Here is schematic representation of what is happening during apheresis. The machine uses centrifugation to separate different components based on their weight. And plasma being the lightest stays on the left, then platelets, white blood cells, and red blood cells. For therapeutic purposes, we use red blood exchange primarily for sickle cell disease and malaria. White blood cells, we use it for different leukemias, and today for a variety of cell therapies such as stem cells and CAR-T. Platelet apheresis is used in a rare condition called thrombocytosis. And therapeutic plasma exchange, which we will concentrate today on, is used in a variety of autoimmune disorders. Again.
Therapeutic plasma exchange, or TPE, refers to a specialized medical procedure in which blood separation technology is used to remove abnormal plasma constituents. Whole blood is removed from the patient into a blood cell separator, which utilizes centrifugal forces to separate whole blood into its individual components: plasma, platelets, white blood cells, and red blood cells. Plasma can be removed and replaced with physiologic fluids to treat relatively uncommon but usually life-threatening diseases.
So until recently, plasmapheresis was used as a last resort for patients with very difficult medical conditions, usually in ICU, and when everything else fails, they call me and we do plasmapheresis. Now, the American Society for Apheresis publishes every 3 years recommendations for the use of therapeutic apheresis for different diseases. This is one example from last year's publication for neurologic diseases. As you can see here, they're categorized at category 1, highly recommended category 2, recommended after use of certain medications. In category 3, we really don't know, kind of a gray zone. Interestingly enough, as of last year, ASO has listed Alzheimer's disease as an indication for therapeutic apheresis. Next slide. The first disease treated with therapeutic apheresis in the United States was Myasthenia gravis. Peter Dow, who I was his fellow at the time, first described autoantibodies against acetylcholine receptor in patients with myasthenia gravis. For those of you who are not familiar with this disease, it is an autoimmune disease which creates autoantibodies to acetylcholine receptor, and the signal between nerve and muscle is impaired. It doesn't happen regularly, and patients are weak, tired easily, and one of the typical signs is ptosis of the eyelids. As you can see here, this is ptosis of one eye. The response to plasmapheresis is really dramatic. This, as you can see here, this happens not after the pheresis, but during the pheresis. So patients really don't see, they cannot open their eyes, and all of a sudden, in the middle of the procedure, they open up their eyes. It's very dramatic. And it was all believed to be due to the removal of the autoantibodies against the acetylcholine receptor. So as we were doing these experiments, I was surprised to see that some patients in whom we could not identify anti-acetylcholine receptor antibodies had the same response. And then we started doing immunologic tests, predominantly with flow cytometry, and we found out that during the procedure, after certain procedures, we were able to change the CD4 to CD8 ratio. And that's important in autoimmune diseases because the ratio is high in autoimmune diseases, and we normalize it with plasmapheresis. And this indicated to me that not only the humoral immune response is affected by plasmapheresis, but the cellular immune response as well. Many other authors after us have described the same phenomenon and took it even further. So today we know that the mechanism of action of therapeutic plasma exchange is not just to remove stuff, but it does other things. So that's one of the paradigm shifts in understanding the plasmapheresis. Next slide, please. So another paradigm shift that occurred over the last 2 years, or maybe 3 years, is that there were certain diseases that were not very common. And there are, as you well know, and you heard this morning, there were new diseases that emerged over the last 3 years. And you can see here that they're somehow connected. All these diseases are connected by the fact that they're associated with infection, which somehow triggers an autoimmune response. And the autoimmune response can affect different parts of the body, primarily the neurosystem. So we find autoantibodies in these patients. We find high inflammatory markers. And in some of these patients, we find coagulation abnormalities. Almost 3 years ago, we published the first report of therapeutic apheresis in long COVID patients. And we described the immunomodulatory effect of therapeutic apheresis in this particular disorder. Next slide. As you can see here, we treated a patient who was wheeled in our clinic. And after the first treatment, he was able to walk out. After the second treatment, he was able to do normal, regular things. And after 3 treatments, he was able to climb stairs and do everyday duties as if he was never sick. We were able to lower all his inflammatory markers, SED rate, CRP, and at the same time, D-dimer. He had coagulation abnormalities. And most of you probably know that ferritin is high in patients with long COVID and COVID, of course. And this is believed to be due to inflammation. Next slide. We did different proteomics. And one thing that is of interest, we knew that from other experiments, but here it showed up again, is during plasmapheresis, everybody believes that we remove proteins. And yes, we do. So there are proteins that are downregulated, as you can see here on this slide. But surprisingly enough, there are proteins that are upregulated. So it happens that the downregulated ones are pro-inflammatory proteins and the upregulated ones are anti-inflammatory. So again, the mechanism of action is very complex during this procedure. Next slide. Here you can see on the left side, before the first plasmapheresis, after the first plasmapheresis, the plasma is really unusually dark. I'm blaming this to the ferritin, but there may be other toxic substances in there. And after the second procedure, the plasma, how it usually looks, transparent, gold-like. The next slide. On the left side is a chest X-rays before we started treatment. This was labeled as pulmonary fibrosis by the radiologist. 2 weeks after we treated this patient, this is on the right side, almost all of this has disappeared. This is very fascinating and difficult to explain, but it's a fact. We have treated several patients with pulmonary fibrosis due to other etiologies, but such a dramatic response I really haven't seen before. I think a few months ago, we examined what we have done with long COVID in our practice, and the symptoms that you all know are fatigue, brain fog, peripheral neuropathy, and anxiety. We treated these patients with plasmapheresis plus low-dose IVIG for 3 weeks with 6 treatments, 2 treatments per week for 3 weeks. And in 65% of the cases, we saw an improvement. Next slide.
I came to Kiprov's office 3 weeks after I had finished the hospital stay. When I came here about a half ago and did the first apheresis, I couldn't walk off of an airplane without collapsing into a wheelchair.
The day after the apheresis, it was as if I had a different body, and no longer were my lungs an issue for breathing. And the difference was truly remarkable. COVID was that I did lose my sense of smell, my ability to taste, My ability to taste was actually, as it came back, it was even weird until the apheresis, and then all of a sudden I was able to taste normally again. And now I notice that I can smell things other people can't smell. But the difference in the apheresis has been really, really dramatic for me.
Next slide.
So I've had essentially long COVID symptoms since I had my COVID vaccine literally 1 year ago, a couple of days ago. Very debilitated. It really changed my life in an instant. I developed pericarditis, neuropathies, brain fog, memory loss, vertigo, visual disturbances, POTS. I had difficulty with my blood pressure, heart rate, sensation, gastroparesis, menstrual issues, extreme fatigue, shortness of breath, for chest pain, you name it, I had it. And I am a very proactive person, so I've literally tried everything that you could possibly throw at to try to get this better. I've done so many different medications, so many different supplements, herbs.
Another disease that you're going to hear more about over the next day or so is PANDAS. There are a couple of studies, one of which is controlled clinical trial, that shows that plasmapheresis is effective treatment for the disease. Remember, all these patients with PANDAS come to us or to other physicians and undergo plasmapheresis after they have gone through a variety of different treatments, including high-dose IVIG. Next slide. So we had 7 patients. All of them had OCD. 5 of them had tics. 1 had incontinence. 4 of them had suicidal thoughts. 1 of them was unable to eat and drink or refused to eat and drink, and they had to go to the emergency room every day to give her fluids, give her saline so that she can survive. All of them improved, although it takes a certain amount of time, sometimes months, until they get. But the improvement is really very dramatic, especially the suicidal kids. Their parents are so concerned that they wouldn't let them go anywhere on their own and all that. It's a very dramatic to see in people. One thing I have to tell you is that PANDAS, it appears, at least in our practice, to be not only a pediatric disease. It occurs in older patients. This last patient that didn't want to eat and take fluids and all that was 21 years old. So today she's 23. She's doing very well. Another disease that is very important in general is Alzheimer's disease. Several years ago, I started working with a group in Barcelona with very interesting people, with very interesting ideas, and a lot of money from Grifols, which is a company that makes albumin, which we use in plasmapheresis. And they suggested that we do a controlled clinical trial in Alzheimer's disease using plasmapheresis with the exchange fluid being albumin, and Grifols sponsored the study. The etiology of Alzheimer's disease is very complex. Initially, it was thought that is the beta amyloid that deposits in the brain in a fibular fashion and causes patches. The p-tau was implicated as well. It turns out, though, that is much more complicated than that. There are genetic factors involved, there are vascular factors involved, the immune system is heavily involved, there's neuroinflammation, and of course, aging, senescence is a factor. This is a disease that occurs in patients who are over 65, 70 years old. So all these factors in today's, when we do research, we call them exposomes because we're exposed to different factors that we don't have control over, and some that we have control over, like diet, for example. Next slide. Here you can see over certain years, we've studied more than 4,000 patients with proteomic analysis, and over the years, the proteomes of the patients changes. On the left side, you see it's all blue, and these are the proteins of younger people. And as you go to the right, the proteome changes. There are different proteins that circulate in the blood, and many of them are toxic to the body. Next slide. So for those of you who have not been involved in controlled clinical trials, of difficult diseases over a long time. It takes a long time and a lot of effort to complete that. We started in 2004 and completed the study in 2019. So it took 15 years to do it, and we went with pilot studies. We extended the pilot, and then we did the phase 2, phase 3 trial, and finally did the controlled clinical trial that was randomized and was called the AMBAR study. It was published in 2020, right in the middle of the pandemic, and we didn't get any attention because the attention was somewhere else. Next slide. However, the results were very encouraging. In the medium severe patients, we saw 66% arrest of the progression of the disease. This was the goal. The goal was to see arrest of the disease. They don't progress. The secondary points of the milder cases, we saw 61% improvement in speech, in memory, and the ability to function with normal family members, friends, and so on. Next slide. These are proteomic analyses, both of serum and CSF. And here again, you can see that certain proteins are downregulated while others are upregulated. And it was really an interesting phenomenon to see. I'm sure that you know that over the last year, a couple of monoclonal antibodies were approved for the treatment of Alzheimer's disease. I don't know if you have any experience with them, but they are pretty toxic. The patients have to undergo MRI, and with the combination of the MRI and the monoclonal antibody, they develop severe edema of the brain because of the damage that the antibodies cause. And there have been deadly results as well. So here you can see that the AMBAR study, which is our study with the plasmapheresis, had much better results in terms of the outcomes and had much lesser side effects. Because what we do is we alter the inflammatory process and we remove the amyloid beta as well. So since then, we have treated a number of patients with Alzheimer's disease. It is very important to catch them as early as possible. The more severe the disease, the more progressive the disease is, the less success you're going to have with any drug that's available today, including plasmapheresis. But if we catch them earlier, then it becomes much more promising. There is a genetic form of the disease that can start much earlier. And we have treated some patients actually preventively, prophylactically, to prevent them to develop the full-blown disease. We're treating 2 sisters that come from Portland to California for treatments. They lost their parents at age 50 from Alzheimer's disease, which is very unusual, but they have the genetic predisposition. Their livers produce amyloid very fast, and we remove that and try to prevent them from developing the full-blown disease. Next slide. I would like to draw your attention to another double-blind placebo-controlled trial of TPE in the field of anti-aging. Today, this is a very popular field. I've been involved in this field for many years, but until there is a controlled clinical trial, it's very difficult to convince most people that it works. So we designed a controlled clinical trial about 2 years ago and recently completed it. Some of the results are I'll present to you, and some of the results are not available yet, but we are encouraged. Next slide. As you probably know, biologic clocks are very popular these days. And we work with Steve Horvath in his lab. And this is the Grim Age clock. It's too bad that I don't have a pointer here, but on the top left side, you will see the treatment groups, and the blue line goes down, which means that their age decreases. And interestingly enough, it decreases over time. It is not one treatment, but it's the number with every consecutive treatment, they get younger. And you can see the grim age on the left side, and the people who did not get real apheresis, they get sham apheresis, the control group, they actually get older, as you'd expect. We all get older chronologically every day. Next slide. This was confirmed by another lab through diagnostic, and my good friend Ryan Smith did these experiments. The same thing, the purple is the grim age, and on the right-hand side is the pheno age. So while we were doing these experiments, a collaborative effort between Harvard and True Diagnostic came up with a new biologic clock. This is a field that changes every day almost. It's a difficult field. They change the algorithms and they change the way things work. But this clock, the new clock, is very interesting because it not only measures the biologic age as a total, but it actually gives you the biologic age of different organs. So here you can see that the biologic age of the hormonal status of our patients improved. And we have the same thing for the lungs. And other parts of the body were not affected statistically. So it was a very interesting finding, and we continue to use this new clock exclusively now for all our new experiments. Next. This is the lung study. The purple is showing a dramatically decreased age for lung, the respiratory system. Next slide. So you can go through several of the next slides here. These are proteomic analysis of different stages of the trial. And these are the proteins that were downregulated. As you can see, many of them, including the amyloid, are lipids. The lipid profile of these patients changes dramatically with this treatment. So we remove LDL, apolipoproteins, amyloid, and so forth. Next slide. Next. 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 So this is a patient who underwent sonogram of his carotid arteries prior to the treatment. In fact, he was afraid to tell us because he thought we are not going to accept him for the treatment. And it was diagnosed as moderately obstructed carotid arteries. Next slide. So he repeated the same test after he finished with us, 6 treatments, and the report is quite wide open. There are no plaques, no nothing. So this moment is anecdotal because we don't have this study in every patient that we did, but it is interesting enough to encourage us to do more studies along these lines. Next. So in addition to the biologic age, and the proteomics and metabolomics, we had some clinical measurements. As you well know, in older people, sarcopenia is a major problem. So we measured strength with hand grip. We measured balance, which is impaired in older people. And there is a test called Up and Go that measures speed of people walking. And there is something new today. This artificial intelligence tells you how well people are doing. As you can see here, progressively patients did well in terms of hand grip, which is muscle strength, balance, and started walking faster. And overall health as well as emotional health improved according to ML. And all that is good, but until the patients tell you that how they feel, you don't know. So next slide.
I felt incredible after the procedure. I felt I had more energy, woke up feeling less achy. Just overall felt really good. Big difference.
I feel great. I feel more energy. I've put on muscle mass. I also just have a drive, absolute drive, and I just feel very, very happy. And I also have a wonderful sex drive. And I'm 75.
I've wrapped up my 6th treatment here at the clinic, and I tell you, my life has kind of changed after I started here. I think it's after my 4th treatment, I felt such stamina and, my God, my strength level. I can open jars now, where I couldn't before. You know, when you get older, it's really hard to open. I'd have to ask my husband. But now I can open my jar and open my vitamin pills. If I had a big day where I had to be very active, I would be shuffling myself to the bed, and I'd have to take a pain pill at night. But I haven't had anything for 3 months now. I haven't needed it. My pain is gone, actually. I have pain in my hand, my legs, and I don't know how to thank you.
Next slide. So in summary, plasma exchange is a multidimensional procedure that affects the inflammatory status. As you know, aging is also called inflammaging. It affects cellular senescence. We don't remove the senescent cells, but we remove the product of the senescent cells, which is called SASP, and causes inflammation. And we affect immunosenescence, and we have studied this with immunofluorescence and flow cytometry extensively. I didn't show you the results. Not all of the results are happening yet. So overall, we changed the old milieu to new milieu that is much more receptive to growth of stem cells and other cells through the entire body. Next slide. Next slide. So I'd like to thank my staff. Without them, I wouldn't be here or anywhere. They're incredible, and they have created a culture and atmosphere that the patients love. And I don't know if you can see that, but there is a little dog that plays a big role in what we do.